Picture this. You're on a super busy ER rotation, right? It's 2 a.m. A 70-year-old patient rolls in. They've got a fever, a cough, bringing up green sputum, and they are really short of breath. The waiting room is absolutely packed. And man, the pressure is on. So, do you send this patient home with a prescription? Do you admit them to the general ward? Or do you rush them straight to the ICU? It is a serious, high-stakes clinical dilemma. Salam, welcome to A Little Push, 5 Minutes Medical Mnemonics. I'm your host, and today we're tackling exactly how to make that crucial admission decision with total confidence. So let's jump right into it. All right, looking at this patient's chest x-ray, you can see that classic consolidation in the lung. It's textbook community-acquired pneumonia, or CAP. Just as a quick refresher, CAP is basically pneumonia that develops before admission or within 48 hours of being admitted to a hospital. Our patient definitely has it. But we need an objective scoring system to actually dictate their site of care. We can't just guess here. Well, fortunately, we have this incredibly high-yield mnemonic that is literally essential for your clinical rotations and board exams. It's called the CURB-65 score. Let's break down exactly how this scoring system works, letter by letter. Okay, starting off the mnemonic, the C stands for confusion. Now, we're not just talking about a baseline dementia here. We are specifically looking for a new onset of disorientation. Are they suddenly disoriented to person, place, or time? Or maybe they have an impaired level of consciousness. You know, if your patient is usually sharp as a tack, but suddenly can't tell you where they are or what year it is, they get 1 point for the C criteria. Next up is U, and that stands for urea. More specifically, we're looking at the patient's blood urea nitrogen, their BUN level. The magic number you absolutely need to memorize here is 20. We're looking for a BUN greater than 20 milligrams per deciliter. So if that lab work comes back and the BUN is elevated above that 20 mark, you go ahead and add another point to their score. Moving right along to R. This one is for respiratory rate. You're at the bedside, observing the patient's breathing, and you are looking for a rate of 30 breaths per minute or higher. I mean, this is a glaring, immediate clinical sign of respiratory distress. If they are puffing away at or above that 30 breaths per minute threshold, they definitely earn a point. Okay, the next really crucial letter is B, which stands for blood pressure. Basically, we're checking for hypotension here. And the parameters are super specific, so lock these in. You give a point if their systolic blood pressure is less than 90, or if the diastolic blood pressure is 60 or less. This is a huge red flag, telling us the patient might be requiring some aggressive fluid resuscitation. And finally, we wrap up the whole acronym with 65. This one's straightforward, it just stands for age. Any patient who is 65 years of age or older automatically gets 1 point. We do this because age is a massive independent risk factor for severe outcomes when it comes to pneumonia. So you go through, you add up the points from these 5 variables. But what do we actually do with that total number? Let's look at how this builds our clinical game plan. All right, let's map those points directly to your admission decision. This is where the rubber meets the road. If the total score comes out to a 0 or a 1, the patient is at a low risk of death. Usually you can safely treat them at home as an outpatient. Now, if the score is exactly 2, the patient sits at a moderate risk. In this scenario, you should strongly consider hospitalization to the general ward or, at the absolute minimum, very close outpatient supervision. But if that score is a 3 or higher, that patient is high risk. They need definitive inpatient treatment, and honestly, you should be heavily considering admitting them straight to the intensive care unit. Now, I want to pause here because there's a really critical nuance behind these numbers. You always have to put your vital signs first. That R for respiratory rate and the B for blood pressure, those are your immediate, glaring red flags. They are the absolute most critical components for identifying a patient who is acutely crashing right in front of your eyes. But on the flip side, we have what I like to call the U factor. Do not forget that an elevated BUN, that U, isn't just some generic sign of dehydration or minor kidney issues. In the specific context of pneumonia, an elevated BUN is a really strong, independent predictor of mortality. It's basically a systemic danger sign shouting that this infection is taking a severe toll on the patient's body. All right, so it is time for a quick rapid review quiz just to really lock this into your memory. I'm going to read the question, and I want you to mentally calculate the score and make the call. Ready? Here's your patient. You have a 70-year-old presenting with pneumonia. They are fully alert. Their BUN is 18, their respiratory rate is 32, and their blood pressure is 110/70. So, what is their CURB-65 score and what is their disposition? Take a few seconds to think it over. Okay, let's reveal the answer. The score is exactly 2.
Let's walk through the math together really quickly. They're alert, right? So no point for C. The bun is 18, which is under our threshold of 20, so no point for U. Their respiratory rate is 32, which is definitely above that 30 mark, so boom, they get 1 point for R. Blood pressure is totally normal, so no point for B. And finally, they're 70 years old, which is over 65, earning them 1 point for age. 1 + 1 = 2, and just like we covered, a score of 2 puts this patient at moderate risk. So the correct disposition here is to consider hospitalization or, at the very least, very close outpatient supervision. And honestly, that is exactly how you use the CURB-65 score to save lives and make those really objective, evidence-based decisions right on the fly. I really hope this breakdown helps you out on your very next rotation or exam. Keep giving your medical knowledge a little push by actively recalling these mnemonics. I mean, think about it. How many other simple 5-point scores do you know that can objectively dictate life or death triage in the middle of a chaotic ER? Mastering tools exactly like this one literally changes the way you practice medicine. If you found this explainer helpful, make sure to join us for more bite-sized medical mastery. Until next time, so long.